Hello, I'm Jeff Cummings, Director of the Cleveland Clinic Ruvo Center for Brain Health. At the Center for Brain Health, we take care of patients with Alzheimer's disease, Parkinson's disease, and multiple sclerosis. We conduct research and perform clinical trials to try to find new treatments for patients with these brain diseases. A critical aspect of our care is to work with caregivers. This series of videos introduces you to aspects of caregiving, including how to take care of yourself.
Dementia is defined as a condition where progressive deficits in memory and other areas of cognitive functioning, such as language and thinking, interfere with the ability to independently carry out daily tasks. Alzheimer's disease is the most common cause of dementia for those over the age of 65. While the likelihood of Alzheimer's disease increases with age, it's not a part of the normal aging process.
Dementia can result from any number of changes affecting the brain, often more than one. These changes can be the result of strokes, infections, or nutritional deficiencies. The most common cause of dementia is brain degeneration due to Alzheimer's disease. In this disease, the early accumulation of abnormal proteins, so-called plaques and tangles, the pathological hallmarks of Alzheimer's disease, results in a loss of connections between neurons.
Forgetting recent events, loss of interest in social activities, or getting lost in familiar places are often early warning signs. Depending on their level of insight, an individual may not even perceive that anything is different.
Family members may observe changes in cognitive function involving language, thinking, or judgment. It can become more challenging for a loved one to carry out complex tasks, such as paying bills, preparing meals, or scheduling appointments. The person may appear depressed, apathetic, or anxious. Changes can be subtle at first and are often hard to recognize. If symptoms progress, it's important to seek medical attention.
It's really tough when you don't know what it is and you don't understand what's going on with someone you've known for over 60 years. But when it is given a designation, then you can learn.
Diagnosing Alzheimer's disease is a complex process. During the initial visit, the doctor will explore a number of different areas to begin the process of determining whether the symptoms are due to Alzheimer's disease or something else.
The physician will ask questions to better understand how memory loss or changes in thinking and behavior are affecting the person's ability to carry out daily activities. Medical history and current medications are reviewed to exclude other potential causes of cognitive decline. Physical and neurological examinations are also performed. Simple cognitive tests are usually administered to help characterize and quantify memory loss and explore other changes in cognitive function.
Additional testing is often requested. This can include blood tests to exclude infections, vitamin deficiencies, and other abnormalities that could cause memory loss. Brain imaging is a very useful tool. For example, shrinkage of memory centers, as seen on an MRI, is a telltale sign that Alzheimer's disease is present. Neuropsychological testing is often called for if the changes seen are very subtle.
The diagnosis of Alzheimer's disease is usually made based on the following test results. Blood tests do not show infection or other abnormalities. There is no significant mood disorder such as depression. Brain imaging does not show other possible causes. Yet, testing shows clear-cut memory loss and evidence of decreased capacity to manage daily activities.
It was helpful for us to be able to understand what was happening to him. It was beyond just normal problems with memory, that it was attached to more. It was helpful because it gave us the ability to be able to look for answers if we could find them.
There are times when an individual experiences significant memory loss with no clear impact on their ability to carry out daily activities. In these instances, it's more difficult to make the diagnosis of Alzheimer's disease with confidence. Physicians often refer to this as mild cognitive impairment, or MCI. Those diagnosed with MCI are at higher risk of developing Alzheimer's disease. However, it's important to note that not everyone with MCI progresses to Alzheimer's.
In circumstances where the diagnosis of Alzheimer's is not clear, other tests, such as a PET scan and spinal tap, are sometimes used. Because there is no single definitive medical test for identifying Alzheimer's disease, arriving at the correct diagnosis can take time and patience.